Welcome to Maximal Being,
a podcast devoted to ditching fad diets and using real science to get you healthy and feeling great.
I'm Doc Mock, a GI and functional medicine doctor who harnesses the power of gut health to get you achieving your goals.
And I'm Jacky P, a well-informed layman who challenges the experts and asks the questions that you want.
Don't forget to hit the subscribe button or leave a comment.
And now, on to the show. Hello, Maximal Beings. It is I, your favorite layman, Jacky P. I am here with, of course, the man, the mystery, the calf muscle monster himself, Doc Mock. And we're here with Dr. David Miller. And we're going to be talking about acupuncture, which is one of my favorite actual topics. So I already warned Dave, there are going to be questions flying at him left and right. But introduce ourselves. As you all know, I'm Jacky P. I have extensive medical background. I watch a lot of Scrubs and, Grey's Anatomy. So I'm pretty much a doctor. And I'm the layman. I'm gonna make sure these guys don't go above our heads and use medical jargon. And over to you, Doc Mock.
What's going on, Maximal Beings? Doc Mock here. I'm a therapeutic endoscopist, which is a fancy type of GI doctor that deals with cancer. And I am also a functional medicine doctor. And Jacky, I feel like if you watched House enough, you basically know the differential diagnosis. I mean, It's always sarcoid or lupus. It's got to be in there somewhere. So, you nailed that one. So excited to have Dr. David Miller here. Dr. Miller, you want to introduce yourselves to the Maximal Beings?
I'd be honored to. Thank you guys for having me. It's really fun to be here. So I'm Dr. David Miller. So I'm the medical director for pediatric integrative medicine with the UH Connor Integrative Health Network and Rainbow Babies and Children's Hospital. And I moved to Cleveland about a year ago, just before the pandemic, not my fault. And had been in Chicago before that. I did my conventional training in pediatrics and then went back to school, ultimately did a 4-year program in Chinese medicine, which included acupuncture and herbal medicine, bodywork, mind-body therapies, and then practiced for about 15 years in private practice after that. Yeah. And so back to you, Doc Mock.
Yeah, again, we're so excited to have you on. And I think it's really neat to see doctors that venture outside of conventional Western practices. And, there's so much out there. I think that medical school kind of pigeonholes us into thinking a few different therapies. We've shared this in prior episodes that, my nutrition planning and teaching was a total of 6 hours. Only 2 out of every 10 medical schools teach anything about nutrition. And there are all of these wonderful tools at our disposal that we learn nothing about. And I think acupuncture is one of those. So I'm going to have Jacky P lead it off.
Paleo, keto, vegan, and carnivore. Maybe you've tried them all, but did you have success? Are you still doing that diet? Turns out there's not just one diet right for one particular person. By understanding how your body works and the relationship behind your body's workings and these diets, you can then approach the perfect plan for you. In the Perfect Human Diet course, we talk to you about your body's inner workings and the pros and cons of each plan. We discuss how our ancestors ate and have eaten and lay a framework to tailoring a plan that is perfect for you. To learn more about the Perfect Human Diet course, head to maximalbeing.com/courses to find out more. And as always, I'm Doc Mock, and I'm here to maximize your health. You cannot supplement your way to health, but there are things that we need to add to our lives that can maximize our pathway to wellness. The American diet is virtually devoid of omega-3 fatty acids, which play a major role in cardiovascular disease, gut permeability, and mental health. Personally, I take omega-3s every night, and iHerb is the best place for clean, natural sources of supplements. I love the ZenWise omega-3 fatty acid supplement, which is free of fish burps and good for the environment. Head on over to maximalbeing.com/iHerb, that's IHERB, and enter the code B as in boy, D as in dog, B as in boy, 5528 and receive 10% off your orders for all supplements. Maximize your supplements with iHerb.
Dr. Miller. It's the last time I call you Dr. Miller. After
Okay.
this, you're Dave, all right?
Fair enough.
Okay, so I want to start at the very basics, right? I know a lot of folks have probably heard of acupuncture. They've probably seen it in movies or know other people that do it. Let's break it down, 3,000-foot view of acupuncture. Like what is it? What does it involve? And then we'll take it from there.
All right, sounds good. So acupuncture involves the use currently of individually wrapped, generally speaking, sterilized stainless steel little filaments that we try to avoid calling needles, but they're also called needles, in order to affect change in the body and to restore health and balance to the body. It's a system of care that comes out of Chinese medicine and is intimately entwined with Chinese medicine and developed out of that system over a period of at least 2,500 years. We have the advantage of machine-tooled, sterilized, as I said, like little filaments to do that now, which was not always true historically. So historically, they would use much larger brass and iron and bronze kinds of things that were not up to our safety and cleanliness standards. But so we have a lot of luxury actually in the practice these days. And so acupuncture can be applied to a very wide variety of health conditions. I think it's most thought of currently as a modality that we might use for pain. And I think it's also important to look at acupuncture from both within the ancient Chinese medical system from which it came, and then also there's modern usages of it and sort of different ways of applying it, sort of in some sense independent of that system too. So Jacky, what else would be interesting to know?
Like I said, strapping. Okay, so you said this has been perfected over 2,500 years. Okay, now like I want people to think 2,500 years. All right. And maybe this might be a question for you, but this is something I've always wondered. How did this come about? Did someone like fall, land on a stick, it hit their elbow, and they're like, oh, my headache's gone? Like, is there history there, or is there just theory?
That's a great question. And this is an area of exploration that's still being sort of excavated, I would say, in the field. What we have is we have texts going back very clearly that far back that talk about using acupuncture and using it as part of a system of care. The acupuncture system is actually organized in a very structured way and in a moderately complex way. And so you have the acupuncture points that many people have heard of which there are somewhere between 350, 400, 450, depending on how you look at it. And then those points, though, are by and large organized along acupuncture channels, which I understand to reflect certain sort of biomechanical functions that we need to do to survive. So very basic things like, eating, running, hunting, food gathering, things like that, that fit into sort of all of our physiologies. And these channels are thought to have preceded the concept of individual acupuncture points. How and why people first got the idea of treating the body this way and looking at the body this way remains unknown, but it's speculated basically that it's a combination of sort of aha moments, like you mentioned, like someone really did push somewhere and had an odd sensation elsewhere, or found that when they, our most basic instinct when we're hurt, for example, is to hold on to the area, so we have sort of these automatic responses. And so I think that system really has developed over time, looking at that sort of aha moment of if I do this, then this happens, and then expanding on that idea. So sort of generally speaking, I guess that's what I would say.
So definitely like not aliens or like any sort of
Correct,
supernatural
as far
intervention.
as we know. Unfortunately, there's just no data on that.
Okay. Yeah. That's good to know, because so I actually am a huge fan of acupuncture. I go every 3 weeks.
Nice.
And I always go in there, and he has the chart with all these, quote unquote highways, and he explains to me, I have sickle cell, which isn't like a secret on the show. And he says, Chinese medicine, they refer to as sticky blood. So like, these are points because it helps your blood and everything. So what I want to do is talk about the chi, right? Like those highways you talk about, right? This is kind of where it becomes a little metaphysical, like the energy, right? But can you, I guess, explain, as scientifically as possible, like how does the Western medicine account for chi, right? Like, and aligning your chi?
Yeah. So I think the first thing to understand is that the word qi gets used and misused quite frequently. So qi in many senses is as general as the word energy. And
Okay.
so we can think of it as like energy that runs through a light bulb. You can think of it as like this person or that person has good energy or bad energy. You know, you go to a certain place and it has a certain feel about it. In English, we say, oh, it had a great feel. It had, you know, good energy to it. In Chinese medicine, you might say it had a certain type of qi that goes with it. So qi is really a very general term. And then there are many, many different types of qi that you can talk about. So there's often this sort of, I think it's essentially a misunderstanding that when we talk about qi, we're talking about sort of a metaphysical life force kind of component only, right? And I think the concept can encompass that idea, but it is not limited to that idea. And that's a really important piece. So when you're thinking about how the body functions, you know, I think in Western medicine, we're used to thinking of the body in terms of parts. So my hand, my heart, my liver, my leg, whatever it is, as sort of disconnected pieces. And I think one of the reasons for that is because the medicine in the West really evolved from sort of a cadaveric view, meaning we took bodies, we cut them up, we looked at the parts, but unfortunately, most of the time, those bodies were not living anymore. And so, you know, we looked at structure and form and then understood function from there. But didn't necessarily fit everything together into a systems-based medical system. And that's why I think Chinese medicine and like a conversation with functional medicine makes so much sense, because we started in the West to move towards, you know, really thinking of our body as circuits and collections of parts that work together to accomplish specific acts. So like eating, for example, you need the mechanical components of eating where you chew up your food and you swallow it and it goes down. But you also need to be able to realize you're hungry. You need to be able to seek food. You need to be able to prepare your food. There's like all of these things that go together into a food acquisition system that is just beyond that physical form of your stomach itself. So if you talk about the stomach in Western medicine, people are thinking of your physical stomach. When you talk about the stomach in Chinese medicine, you're talking about your entire food acquisition system. And so it's a much broader way of looking at form and function. And then I can say, you know, there is energy that powers your food acquisition system, right? That's your stomach qi. And so it's a specific type of energy within a specific system that does a specific thing. So you have stomach qi, you have spleen qi, you have liver qi, you have heart qi. There's all these different types of qi. And so I think part of translating from East to West is to understand also how the language is used. I think it's also really important when you're thinking about Chinese medicine, as I start to use the language here, that we understand that when I'm talking about these pieces, I'm not necessarily talking about them at all in the same way that the West would. So we talk a lot about spleen qi in Chinese medicine, has almost nothing to do with your physical spleen. It really is talking about your capacity to incorporate either food or knowledge into yourself. So when you eat that food using your stomach, it has to get incorporated into your body. That's your spleen's job in Chinese medicine, not in Western medicine. So there's a lot of complexity in talking about it because we use, unfortunately, the same words through translation that mean very different things. And so it ends up being a form of medical jargon, which frequently leads to misunderstanding. So I'm curious, Doc Mark, how's that sit with you as a functional medicine doctor too? And then I can keep talking, but I want to share the space a little bit.
No, I think it's so fascinating that, you know, it's taken us now the year 2021 to get to the point where we're now looking back at the human being as a system. And in my world, you know, both in functional medicine as well as in gut health, the microbiome controls so much of us globally as a person. We're discovering more and more how important it is that something within your gut can control your brain, can lead to cardiovascular disease, can increase your risk of cancer throughout the entire human body. But before that, you're right, we did think of everything in these little boxes in our training, and doctors are placed in little boxes, right? I'm a specialist, right? I deal with the gut. Now, if you're talking to me about diabetes, I don't want to hear it, but they're all intimately linked together. And so we knew about that thousands of years ago with the discovery of acupuncture. And now it's taken us this long to kind of get back to that point. So I'm 100% with you. I also want to just outline how important the letter Q is. Not just in the word chi, but also, you know, to Jacky P and this wonderful human being that is a part of his life. The letter Q just seems to be super important.
Q actually is a power letter. In Scribble, it's 10 points. right? It's just one of those things. So yeah, I like the letter Q. It's one of my favorite letters now. But it's also interesting. You bring up a good point, Doc, how like you talk about gut health, but someone comes with diabetes, right? Like in the Western world, like that's not your lane, so to speak. But, you know, folks who are listening, it's always when we speak to anyone about anything, it could be cardiovascular, it could be the gut, it could be the pancreas. All of the solutions that make you healthier, quote unquote healthier, are the same. So there's something there where there's a lot of overlap. Or if you're having, you know, cardiovascular disease or issues with your gut, the answer is usually the same. There's a lot of overlap. So it speaks to a larger system where like, okay, guys, like there's crosstalk here. Like there's a communication, right? And I kind of want to talk about that a little bit because actually I got into acupuncture. I used to be I wouldn't say a denier, but I was just like, I just wasn't the guy who tried new things, right? Growing up with sickle cell, I'm used to the doctors, I'm used to the lab coats. Give me the medicine, give me the whatever, and I'll be on my way. And my wife actually used to have GI problems, and she saw a acupuncture acupuncture specialist. I don't know what the terminology.
Acupuncturist.
Acupuncturist, excuse me.
Yep.
And she used to take like all these medicines. And then literally within like 6 to 12 months, she was off the medicine, right? And I'm not telling people that acupuncture cures anything. This is an individual case, you know, anecdotal with my wife, right? So she convinced me because, you know, my sickle cell, and I always run hot, right? Like I left Florida for a reason, like, you know, and she said, listen, he's going to give you a deal. It's good, like very cheap, like just try it. And this was 4 years ago. And now it's like, for me, it's almost like a oil change for like a car, right? Like during the summer, now it's getting warmer. He says, okay, how are you feeling? Are you running hot? I'm like, yes. He's like, okay, let's cool you down. And there's different points. And I can tell, you know, back to the energy and the system that like when he does a point, like there's like, sometimes it doesn't hurt, but there's like a zap. And I was like, oh, I felt that. He's like, yeah, I can tell because, you know, X, Y, Z, A, B, C. So through my own experience, I became a believer and hardcore promoter. But I'd like to also talk about, you know, the actual science, right? Like there've been studies. A lot of people use it for chronic pain. I mean, do you use it right now in your practice? You know, would you like to kind of expand on that as well?
Absolutely. Yeah, no, I do. I use it regularly and I use it with all ages, which is a little bit less common. And so I'm part of a group of people, you know, working to introduce kids to acupuncture and to that system. Sometimes you can do acupuncture with the filaments. Other times you do it through acupressure. And there's a whole system of tween-op massage that you can apply to kids that makes it really easy for kids to receive and for families to practice it at home. But yeah, you know, I think the interesting thing about acupuncture as it sort of unfolds in front of us scientifically is that there are actually many different ways by which it can work. You know, and so there are biochemical kinds of things that it does. Like one of the first things people sort of hypothesized and were able to control and check for was the release of endogenous endorphins. So your own natural pain-killing chemicals. And so they looked at this, you know, part at least in rats and somewhat in people too, by giving them naloxone, which is a chemical that blocks opiates. And they found that they could block that effect of acupuncture by giving people this medication, or giving rats this medication before treatment. And so they identified that that was one biochemical pathway by which acupuncture could have an effect. There are also things like it changes your blood flow dynamics. So it improves blood flow. It tends to relax blood vessels and lead to overall muscular relaxation, which can also lower blood pressure and improve sort of cognitive state, make you feel relaxed and more calm. It may work through a couple of different other chemical signaling pathways, like nitric oxide is one that's hypothesized to be important. It promotes what we call as autonomic nervous system balance. So that balance between your parasympathetic and your sympathetic system, your sort of fight or flight and your, you know, relax and refresh kind of systems. And, but then also I think if we look at, you know, one of my interests is if we look at the way the brain sort of organizes information, there are little images of your body throughout your brain in lots of different brain centers called your homunculi, which are sort of like reflections of your physical form, but they don't exactly look like your physical form. They're kind of more distorted and unusually kind of shaped, but they correlate to different parts of the body. And there are many different brain regions that have these basically little images of your body that are how they organize information. And so by doing acupuncture in a structured way, we're fiddling with the way your brain processes information about your body. And when you start looking at this, you realize that that form and the shape and the position of your body and what you're doing with your body is so intimately intertwined with your mental state, your emotional state, and your physical state, that when you start changing sort of the way the signals are going, you can really alter quite a great deal about someone's physiology. And so, so it really changes the way the brain processes information, about what's going on globally. So Jack, does that make sense, or where does that lead you in terms of what else you'd like to know from there?
I'd like to, and Doc Mock, perhaps you can back us up here. I know there's, there's articles that we've shared and we've talked about that just, they took, 50 folks who had chronic back pain, right? Mm-hmm. And they gave them 8 weeks of weekly acupuncture, right? And they responded with having less pain, or something was interesting to me was their pain tolerance was higher, which I thought was interesting. So, in that space, do you see acupuncture, now that they're actually doing these sort of studies, like, is this going to be something that is going to become more prevalent? Is it going to be something that's less, oh, that's Eastern medicine, very specific folks? Is that going to be something that, yeah, you can walk into your local, like, major hospital system and there will be an acupuncture specialist there?
Yeah, that's a great question. And I hope yes, I think yes, and almost definitely yes, I guess I would say. What we've seen over the past couple of years is that, groups like Medicare is sort of very conservative in terms of what and demands a significant level of evidence in order to approve a specific type of a procedure for a specific type of a condition. And they approved the coverage of acupuncture for chronic low back pain in seniors, meaning that they found that the evidence was sufficient enough to approve acupuncture for that condition. And we've seen expansions from there at the state level. For example, in Ohio Medicaid now covers acupuncture for 6 or 7 different conditions, which include a couple of different pain conditions, and then also nausea and vomiting associated with pregnancy, and also nausea associated with chemotherapy. So what we're starting to see is, as more research gets done, we're seeing an expansion of these diagnoses. I think where we're going to run into a roadblock is you can never study everything. Acupuncture is a very general system. You can use it for, there's something for it that it has to say about almost any medical condition, right? But in order to get a good study, it costs a lot of money, it costs a lot of time, you have to have a lot of people, you have to figure out how you control what you're studying for. And it's really just not practical to ask that we have, super high level studies for everything that acupuncture might be able to do. So the question is, will we be able to generalize our understanding about acupuncture's benefit to things like pain control rather than just pain for chronic low back pain in seniors? We need to be able to kind of say, oh, it seems to have these generally useful effects physiologically. We should be able to extrapolate it to lots of different types of at least pain conditions, and then you can look at things like anxiety relief, and hopefully, that's relatively easy to document, at least in short-term benefits. Digestive issues, menstrual issues, all these kinds of things are places where it's been used classically for thousands of years with good efficacy, with sort of this prolonged clinical trial. And it's starting to make its way into the hospitals, absolutely. So like we have acupuncture active and available right now at UH for fertility. We're working very closely with, with the endocrinologists who are doing like egg transfers to support that process, because it's been shown to be, helpful for many people in that in that procedure. We're seeing a big study that's going to be starting for acupuncture in the emergency room and the adult emergency room at UH also. That's an NIH funded grant study. So we're seeing how can we take people who are coming into the ER, and at least for a subset of those people, how can we use acupuncture instead of things like opiates for managing their pain? Because the preliminary studies have shown that acupuncture is extremely effective in helping people decrease pain and anxiety in acute situations like that. So if we could do that instead of loading them up on opiates, that's a huge win, you know. And so we really are already seeing acupuncture incorporated into the mainstream in many ways. I think, you know, the risk I see of this is that because of especially the language barrier in understanding classical acupuncture and the system it came from, that we're going to try to package it like a pill in a one size fits all kind of a protocol that is not how it developed as a system or is conceptually practiced. And so I think the bigger divide is almost in helping the medical system understand that you can have something that's efficacious and safe, that uses a different framework for diagnosis and treatment, that nonetheless has a validity to it. And that, you know, once we get to the place where we feel like it's safe enough, effective enough, that we hire people who've really studied the whole system and just let them do their work.
Okay. I mean, you brought up an interesting point. And this is the last question I'll pass to you, Doc Mock. I know I've been hogging it here, but I told you guys I had a lot of questions. So you said fertility, right?
Yeah.
And so another personal story, my wife did happy baby puncture points when she was pregnant, you know, and I think it worked because if anyone who knows Quinn, he's the calmest, coolest kid. I mean, obviously biased, but like, you know, when he was born, he didn't cry. He was just hanging out. Like he
True
just,
story.
yeah, like he's just like
He's
calm.
the best.
Like he's an old soul.
Nice.
We go to the doctor and he just listens. I mean, he's amazing, but that's a whole nother podcast, hours of material. But you know, if I were someone who wasn't accustomed to traditional Chinese medicine, right, and I'm used to the Western input, and I hear, okay, fertility, or I hear happy baby, right? Like, what are the risks, right? So if we're talking about a very intricate system of chi and energy and, you know, up to 450 points, right? I mean, this must, you know, and these filaments are smaller than needles actually, because you don't feel them. You might miss, right? You might miss a point, like, you know, like, so what is, I mean, is there a risk? I mean, you know, is there like, oh, you hit the wrong point and now, you know, my foot's numb for the next week, or I know I'm being, you know, it's a ridiculous example, but like, is there a risk? You know, are there, you know, downsides, I guess, for lack of a better word?
Right. That's a great question, a great set of questions. I mean, and so what the studies have shown us, there's been relatively large studies along the lines of like 22,000 people showing that in properly trained hands, acupuncture is one of the safest procedures that you can get in a medical setting. It's again, in properly trained hands, it's very easy to apply with minimal risk. You know, biggest risks are things like a slight bruise at the you know, the site of the point. In cases where acupuncture is not regulated properly and people are doing it with minimal or insufficient training, there is a much greater risk of things like organ puncture. And so like pneumothorax, which is a puncture of the lung and a collapse of the lung, is one of the more commonly talked about risk factors for, you know, for acupuncture. And again, it's easy not to hurt the lung. You just have to know what you're doing. And that's why you want to make sure you have a properly trained provider that you're going to. You know, and classically, it's interesting. I mean, there are sort of points that are debated and identified classically that you do or you don't use in certain situations. And so pregnancy is one of those situations where there's about 6 points or so that classically you would avoid. The idea that being that they would be too moving and could potentially induce an unwanted like release of the pregnancy. That said, I don't think anyone actually has seen that happen. So, you know, it's like you don't know whether that original concern came out of the theory of it or something coincidentally happened at some point and that got locked into everybody's memories. But the body's very, we say sort of adaptogenic in the sense of like, if you put a point in the wrong spot, mostly what happens is nothing bad. Like either there's an adjustment there, something relaxes there that's different, or you don't get that combination of point functions that you're looking for. But it's not like you really tend to get a negative effect when it happens. I liken it sometimes to like Tylenol. Like if you have a fever and you take Tylenol, it brings your fever down. But if you don't have a fever and you take Tylenol, it doesn't make you cold, right? It just leaves you at your body temperature. And so I think techniques like acupuncture are sort of adaptogenic like that. They try to bring your body back to balance, but after that point, it doesn't like throw you off balance unless you're applying the system in a way that's really not conducive to, that's really not part of how it would be appropriately applied.
Yeah, I think in reviewing all the medical literature prior to talking with you today, the biggest takeaways for me were, number one, that it is really safe. I mean, there are virtually no adverse events, and the only reported ones are, like you said, slight bruising at the site. And number two, that there showed, if not equal, but superior efficacy as compared to standard pain control techniques. So, I mean, it's really impressive data, folks. Like the research is really well done, and I really appreciate it as an adjunct. So my earliest exposure to acupuncture was this. So I was a gastroenterology fellow, which for the people out there is a doctor in training. And I came to work with this terrible headache. And our anesthesiologist, who is from China, and actually an acupuncturist, comes up to me and says, "Oh, hold on." And so he runs away for a minute. He tells me to just put my hand on the table, and he tells me to look the other direction. And then he jams a needle into my anatomic snuff box, which is like this part of your hand, and starts moving it. My headache went away. It was amazing. So not all acupuncture situations or treatments are like that, where somebody just surprises you with a needle in your hand. But if you could, for the listeners, just walk them through what it's like to get a treatment, what it's like to get a consultation from you.
Absolutely. So from me specifically, may be different than from other people too. There are definitely different structures from which acupuncture is applied. So, we have sort of going from the individual consult structure, which is what I do. So people would come into me and I would do a really thorough history on sort of everything I can about them. We call it the 10 questions sometimes in Chinese medicine, that sort of covers all the basics of your sort of physiologic categories, but also looking at things like, what do you eat? What's your diet like? What's your sleep habits like? Do you exercise? Do you meditate? Do you do other things to take care of yourself? Really applying sort of that full system of Chinese medicine, full system of holistic care. And then if acupuncture is something that somebody wants to do and it's appropriate for their condition, then we would do sort of an individual session of acupuncture where they would generally lie on basically a massage table and get comfortable there, get them all situated, put points in that range anywhere from sort of 6 points to say 18 points. Things like musculoskeletal conditions, usually you end up using more points for aches and pains like that. Or if someone comes in with 16 different things that they need to work on, you sometimes prioritize, but occasionally you'll work on a couple of things that require sets of points. And then they'll usually relax there from anywhere from about 20 to 40 minutes, sometimes with a heat lamp, sometimes with music. But mostly they just get to sit and breathe and take a little nap. And then we take the points out and they go on their way. And then, within the Chinese medical system too, there's like herbal medicine is used. So sometimes we'll use herbal medicine to also help try to treat that condition. People will get a recommendation for certain foods they maybe should or should not eat, certain exercises they should or shouldn't do. So really trying to globally adjust sort of their behaviors as well as treat them specifically there. There's also something called group acupuncture, which is a great model, or community acupuncture is where it started as a name, where you have 5 or 6 people sharing a room, a large room, usually sitting in sort of chairs that recline slightly. And you have 1 or 2 practitioners treating each person sort of sequentially. And then each person kind of usually will self-limit how long they want to be there with their needles in and relaxing. And then those get taken out. But you basically get to sort of share the cost of the visit with other people. And so even though the interview is generally private and exactly what's being treated isn't really public, it allows people to get seen usually for somewhere between $20 and $40 a treatment rather than more, for a private session. So a couple different styles of things there. Doc Mok?
Yeah, I think for the healthcare providers that are out there, we can learn a lot from Dr. Miller in our approach to patients, because your patients out there and all of you out there are not sleeping. We know that it's at least 2 to 6 out of every 10 people. people are not eating right, and people are finding ways to solve these problems with or without you. So, approaching those things head on, like Dave does, I think that's fantastic. I think that we've talked about a lot of great things. I can't wait to have you back on to talk about the Chinese and herbal medicine side of things, but we're going to have to go to a brief commercial break, and we will come back with Dr. David Miller and Jacky P.
What's going on, Maximal Beings? It's Doc Mock here. Many of you are returning to the gym now, but some are not going back. Regardless of what you plan, Rogue has got the right gear to fit your needs. I personally own a barbell set and love it. The Black Ops shorts are sweat resistant and flexible for getting deep in your squats. Head on over to maximalbeing.com/rogue for our referral link. Order 3 items and they ship for free. And as usual, it's Doc Mock, and I'm here to maximize your pathway to wellness. If you're stuck at home and cannot make it to the grocery store, delivery may be the best way to stay clean and healthy. Instacart is the national leader in the direct-to-home delivery service. With numerous major chains and food from smaller stores, you can get those local veggies sent directly to your doorstep. Head on over to maximalbeing.com/Instacart and maximize your nutrition today.
Welcome back, everyone. It is I, Jacky P. I'm here with Dr. David Miller and, of course, Doc Mock himself. And we've been, I guess I've been interrogating Dave for the last, half an hour or so about questions with acupuncture, and it's not stopping because I still have more questions. So round 2, I think these questions I think a little bit more practical. So so I'm just trying to put myself in a non-acupuncture person, right? So, we talked about the process, right? You have the 10 questions. There are different ways to be, there's different ways you could receive treatment right on your own or with a group. And also, side note, there's no nap better than acupuncture nap. If anyone's ever experienced it, the system shuts down. I'm telling you, it's amazing. Anywho, but so you said there's licensing, right? Because you did mention about, folks who are properly trained, right? So what if, if I'm in Philly, there are folks that might not be in, Cleveland, what should we look for, right? Like, I know, of course, you want to make sure they're properly practiced, but is there a resource you can look up their background, so what would I look for to find a well-practiced acupuncturist?
Yeah, so that's a great question. And so I think for most of the country, there is an organization called the National Certification Commission for Acupuncture and Oriental Medicine, the NCCAOM, which is basically the board certification body that assures sort of minimal competence and training, that someone's actually gone to school. They check those boxes, make sure it's legit, they've got all their hours, and then they have testing that they have to do to show that they've achieved, the basic proficiency in the field. And so that's the first thing that people should look for, is that NCCAOM certification. The second thing to look for is, where did they go to school? Did they go to, there's about 50 different accredited colleges of acupuncture and oriental medicine in the US. So did they go to an accredited school? And then you might want to know, did they study just acupuncture, which is usually about a 2-year program, or did they study acupuncture and herbal medicine, which is more like a 3.5 to 4-year program? There are people who are in California who are certified by the California Acupuncture Board. So they have their own, sound, legitimate testing. So if you're in California, you may be looking for that certification. But those are your basic, things you can ask and look for, is sort of, where did you get training? Are you board certified? And sometimes connecting with the state associations can be a great way to find the practitioners out there too, who are really part of the profession and are keeping up their credentials. So looking at the state associations.
Okay, that's actually good to know. I think that's always important, folks. In whatever you're seeking, and you're seeking a professional, you got to make sure they're an actual professional, right? I have a question. So we know that acupuncture can help with a lot of things. What are things that you say, no, this isn't acupuncture, right? If I come in, I got a torn ACL, right? I can't expect some filaments, so what are some, major things that say, okay, this is not an acupuncture type thing? Yeah.
Right. Yeah. I think you brought up a good one. Like injuries where something is really broken, a tendon that has disconnected, something that everybody would agree, like this needs surgery. You do that first and you use the acupuncture to help you with your rehab, but you're not going to reattach a split tendon because of, with acupuncture. I think, it's always in the field, it's always felt very important that, if patients come in with sort of odd, mysterious things that need more of a workup, that workup be done either simultaneously or first to treatment, because things like cancer, for example, there's debate about like the level of assistance acupuncture can give with that. But for the most part, people would say you need to get your cancer treated at a real cancer center, again, incorporate acupuncture as part of your plan to minimize side effects and to optimize own body's natural, role in helping to fight things off. But I would never want to treat someone with just acupuncture for something like cancer. So certainly like serious injury, malignancies like that would be other ones. Something, like mental health disorders where people are not safe, where they're either a danger to themselves or others, and they need that more intensive kind of support. So even though I think acupuncture can be wonderful, and I think there's data to show it for mental and emotional disorders, that again occurs within a range. I think where Western medicine really shines for sure is in acute conditions that are extreme, where patients would either die or suffer really negative outcomes without super intensive intervention. And so knowing when you really want that level of care. I think that the challenge we have in Western medicine is so much of our work has focused on those intensive, offerings, that when someone comes in with something gentle and mild in an early stage, or someone comes in with a chronic condition that's stable, but isn't going anywhere, we don't do really well with helping people in those situations. So does that make sense? I think those are some of the big ones I would throw out there.
No, that makes plenty of sense, folks. So, your doctor's still important.
Right,
I was just,
absolutely. No, very much
right?
so. Right. And know your diagnosis,
Yeah.
and, I think when you're going for acupuncture, generally, like people may know what already is wrong with them, and they're looking for either different strategies or augmentative strategies, but they kind of know. So really odd, mysterious things you want to have, your whole care team involved in to make sure nothing's getting missed.
Okay. It's good to know. Yeah, that's a good point. And I saw something, this is completely unrelated and somewhat related, but it just came to me. I remember seeing something online. They're like acupuncture pads. It was like, you could buy it online. It's like $30 and it's like a pad of needles,
Okay.
or excuse me, filaments.
Thank you.
Trying to.
It's mostly for the kids, but
Yeah. Is that an effective way, or do you think that's just online, marketing,
kind of stuff?
Yeah.
Yeah. It's really hard to tell. I think most of the things out there that are promoting, I don't know, sort of, in a sense, doing your own acupuncture are going to be a little bit questionable there. That said, there are certainly self-care acupressure techniques that people can do, that we teach people to do at home, that can be very effective. You generally don't need a lot of expensive equipment. So if someone's trying to sell you something that's super expensive and high tech and blah, 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 that you're going to do at home, I'm leery of that. The system didn't develop with really high tech stuff because historically it didn't exist. And so it's really meant to be a system that you can apply in very simple ways. And so absolutely there are definitely self-care devices and tools like the shiatsu balls and things that you might roll on spots to, change sensory perception and relax muscles and increase blood flow, like those kinds of things for sure. But the more sort of elaborate kinds of things that are out there sometimes are a little bit more hype than they are grounded in the practice itself.
Yeah, I think we made that point that in the right hands, very safe, right? But in the wrong hands, you could puncture a lung or something like that. So
right. Yeah.
Don't do it. Don't do it at home, folks.
Right. When the kids come to me and they say, "Can I bring a pack of needles home with me?" and you can see the glint in their eye, like, "I want to try this on my sibling." Like, no, you may not. So
better keep the professional stuff to the professionals, kids. And folks.
Right.
Okay. And this is the last question. This is maybe more theory, but this practice of acupuncture is 2,500 years old, right?
Yeah.
I mean, is it advancing? Is it changing? Are there
Interesting.
new
Yeah.
ideas coming out?
Yeah.
You know, walk us through
That's a,
that.
yeah, that's a great question, right? Like, is there still more to learn? And I believe, yes, I believe there is more to learn. I think that one of the things that's really changed about how acupuncture is understood over the years is that acupuncture was classically also practiced sort of almost in family groups, and each family had their own secrets about what they did, and it was very, insider kind of secretive practice, and you had to train for years to get all the access to whatever those secrets were. And in our modern digital age, there are very few secrets, if any. And so there's been a lot more knowledge sharing. So I think for the field itself, even internally, there's a lot of questions being asked about, like, there's 20 different ways I can do my needle technique for any given point, for example, or there's lots of different ways that I can combine needle combinations to affect a specific condition. Can we start studying potentially, like, how do we know what's the best method of application of acupuncture? So when you go to get acupuncture, really, actually, you're not just getting a single thing. The practitioner may go in and put the needle in and manipulate it in one of many different ways to get a specific treatment effect. So when you're trying to cool someone off, for example, there's specific needle styles and techniques that you can do to augment that intention. So I think with our modern sort of understanding of how to run studies, we could start asking some of those questions, which would be really interesting to try to pin down, so to speak, what the truly effective techniques are versus, what's fine, but maybe is more of just sort of hype or whatever. I also think that there's actually an immense amount of research going on right now that's looking at how do we cross over these two fields, whether that be in the domain of acupuncture specifically or in other aspects of the systems like the herbal medicine or nutritional advice. As you're able to start measuring certain things about what you're doing, like hormone levels, for example, or EEGs or functional MRIs, you're starting to be able to combine ways of looking at the body between ancient Eastern ways and modern Western ways. And I just think that gives us a binocular vision that we haven't had before. So even though the historic ways are, I think, brilliant in themselves, they do lack that knowledge of sort of what's going on under the hood. It's much more, clinically based, like, this is out of balance. I do this comes back into balance. Do I know what was underneath that? I don't necessarily, nor do I need to. I have a theory. The stomach chi was disrupted. Okay. But as we're able to study, what that means using these greater instruments, we can really drill down to some other aspects of physiology that we haven't discovered. And I think there's just very likely to be tremendous pay dirt in that in terms of scientific advancement. But I think we're just at the start of that conversation.
That's incredible. No, I honestly think it's something to look forward to. When I went to my doctor, I was like, hey, listen, I'm going to go see someone in acupuncture for my sickle cell and other things. I was waiting for him to say, the whole Western, he's like, no, that stuff is nonsense. But he was like, oh, go for it. Absolutely. And I felt like that was like a good step. Like, oh, okay. Like this isn't like a gang turf war. It's like, okay, we're all trying to go for the same thing. We want our patients to be better. So it made me feel very, very happy. So we got some closing questions here for you, Dave.
Okay.
You've made it through the worst of the interrogation, and I thank you for your
my pleasure. Thank you
for making it through.
Yep.
So the first one would be, what is your favorite book?
Oh, well, favorite book of all time. Now, I know we chit-chatted a little before about some nutritional kinds of focus. So, the one I was thinking about was The Omnivore's Dilemma by Michael Pollan. I just felt like that was a book it was really good, right? It's really well written. It's very readable and amusing, but it also really opens your eyes to like how the food system runs. And I love the whole concept of like, did we cultivate corn or did corn cultivate us? And that idea of, who's keeping who moving when between the plants and the animals in some ways. So that's a favorite one. That's definitely one that's out there.
I've read everything that man has written, and I've listened to his ebook on caffeine. I mean, he's just a brilliant writer.
Oh, I need to listen to that. That sounds great. Yeah.
That's a good one. Yeah, actually, I haven't read that book, but I think that's the second time someone brought it up on the cast. So I think I need to read that so I could come back and be like, yeah, man, I know stuff about this subject. Okay. And speaking of nutrition, do you mind sharing a little bit about your nutrition? I mean, do you follow specific diet? Do you fast? What did you eat today? I mean, did you wake up and, did you fast or something?
Right.
What's Dave's refrigerator look like?
Right. Well, so I'm an ovolactic pescatarian. So I fish and eggs and dairy because my body seems to do okay with that. I don't really eat like other meat products, and so I'm largely vegetarian with contributions for dairy and fish and things for the protein sources. I really enjoy nuts and seeds like green leafies. So this morning I made myself a smoothie with berries and cilantro and parsley and some pumpkin seeds and a little bit of a protein powder in there too. And that's not every day, but that's one of the things that I really enjoy. A lot of salmon, a lot of veggies, probably like all of us, maybe too many carbs still here and there. So, and then I did just have coffee until lunch today because I had too much for dinner last night, but it was a healthy dinner, but it was too much of it. So, yeah.
Nice. Dave, you hear that, folks? Dave is a medical professional who practices what he preaches. All right. So if you're in the Cleveland area, make sure and he falls under what you're looking for, you want to follow him. Last question. What is a personal goal for you for 2021? And it could be anything.
Oh, okay. I mean, so personal or professional, they all sort of intertwine, unfortunately. That's maybe bad boundaries. But, I'm really working to develop this sort of a department of pediatric integrative medicine here at Rainbow and with Connor. And to really see that grow and start to take form and to expand the services that are available to kids in the domain of integrative medicine, including acupuncture. And so I really hope to be able to expand those services to people so there's more access, especially regardless of ability to pay. So having, these kinds of services be covered by insurance, including, public insurance, I think is a really big, an important thing and a goal to continue to work towards.
Well, that's a very fantastic goal. I mean, that couldn't think of anything but like that was fantastic. Yeah, I think I would jump on that goal. I would hope to see the future marriage of Eastern and Western medicine, and just folks to have the open mind that you don't have to cure everything with a pill, right, or a prescription, right? So
absolutely.
Thank you so much, Dave, for going through the interrogating. I hit a lot of balls at you and you hit them all right back. Doc Mock, you have anything else to wrap us up here?
No, I mean, again, if you're having a heart attack, you need a cardiac cath. But, if you're suffering from chronic pain, if you have, chemotherapy-induced nausea and vomiting, pelvic discomfort, if you're having difficulty with fertility, I mean, acupuncture has been around for thousands of years for a reason, and it is here to stay. And I'm so excited to see where the field goes. So I appreciate your community, Dr. Miller and Jacky P, of course. Thanks for keeping us on the straight and narrow and, making sure that we're not nerding out too much over here. For all of those out there, if you have questions for myself, for Jacky P or Dr. Miller, send it our way at team@maximalbeing.com. Check out our new course that launched on the perfect team and diet. I know there can't just be one, but we're going to teach you about all of them, the biochemistry, and we're going to tell that story start and end. And as always, I'm Doc Mock, and I am here with Jacky P and Dr. David Miller, and we are here to maximize your health.
What's going on, Maximal Beings? Doc Mock here. If you haven't done so already, leave us a comment and hit the subscribe button. Let your friends and family know. That way we can get the word out and continue to bash the bro science.